My name is Malcolm Finley. I'm a consultant cardiologist at Barts. Thank you for coming to volunteer at the Royal London Hospital Intensive Care Unit during the COVID crisis. Come on, let's have a look inside. When you get here, get your mask, get your hands, and then at the welcome desk, they'll let you know where to go. If you need your security badge updated, they'll be happy to do it on the security desk here, but let's just go straight away to the lifts. Okay, we're on the 15th floor, and this way is where you'll get scrubs. So, as always, you'll need your pass. And in here, come on through and pick up some scrubs. And then back through here to the changing room. Coming out from the staff changing area, you go this way to find your allocation. You'll turn up here a few minutes before your shift start, and you'll be pointed on the boards to where you have to be for the day. Once again, the security gets me. And then here in the shared staff rest area. All right, now quick introduction to donning. You'll have done this before, so it should just be a brief reminder. Let's go. All right, so the great thing about getting ready for donning is it is much easier than when you're getting scrubbed. So first of all, get your nice gown, and then you better write on it in pen who you are. And then you'll need your FP3 mask. Okay, once you've got that on, that's what you have to be wearing when you're on the unit. Good. So this is the ICU wards. They're all pretty similar and they're all interconnected. So when you're in the intensive care, you know, you can walk through one ward to another, but obviously you don't go out into the area which is into the clean area. So at the end of every bed, you know, it's just like a normal ward or normal ITU really. You've got most of the things you'll need minute by minute, and you can stock that up at the beginning of the day. Then through here, when you need to stock it up, are the stock rooms between the wards. So they've got all the nasogastric feeds. And here's the consumables. Oxygen masks and all that jazz. And on the other side, there's your lines with all the clean fluids and drugs and so on. And around the other side, there's the linen and the cleaner area. Okay. And on the other side, there's the sluice, which you'll probably be running to now and again to clean all the stuff out, do whatever jobs they give you. All good. Okay, let's get to work. So the other thing to say is that the blood gas machines are at the end of the ward with blood gas needles, as well as blood bottles and swabs and those types of things for investigations. All right, so when you come onto the ITU, you'll probably think what your role will be. Well, actually, as a sort of doctor using your skills in the HCA role, you'll find that most of the things you're doing are really supporting the nurse. You all have a ITU nurse who's buddied with you. You'll have to do all your fluid balance charts, your observations, taking blood gases, and also really there's jobs like turning the patients and changing bags and so on. But really the golden rule is whatever the ITU nurses want you to do, you can get in and do it. I wouldn't be nervous, it will be very straightforward here, and you'll be well looked after. Let's just go around the bed space to give you an idea of what we've got here. So, first of all, we've got the chart. Over there, we've got the bedside monitor. You'll have the oxygen sats and the blood pressure. Just always make sure that you're reading off both. Behind that, we're seeing all the pumps with the syringe drivers and infusions. The white one's propofol, and that's really one that you'll love up here. That's keeping the patient asleep. And on the other side, we've got our ventilator. So the golden rule is don't touch the ventilators, but of course some of you will have some training in ventilators, and so you just have to be appropriate to your level of training. Personally, I stay well clear and just write the numbers on the chart if I'm asked to. Okay, for the drug round, you'll just need the drug chart, and all the medications for that patient will be in the drawer here. And so most of the stuff's made up with saline. You'll know how to do to give medications. But these tablets and so on, you'll need the crusher, and the staff nurse who you'll be working with will show you exactly how to do that. So as always, if in doubt, ask. And the general rule is 2 of you sign for every medication. So we're going to show you how to fill in the chart. When I say we, I mean this is Becky, one of our nurses from Whipps Cross Hospital. Becky, do you want to just show me how to go through the chart?
Okay, all right. So just always, before you start, make sure that the chart matches the patient you're looking after. And the observations are charted on the left-hand side from the top down. So you're going to chart the blood pressure in black.
Okay.
You're going to use arrows to indicate the systolic and the diastolic.
Yeah, so I guess the time is 3:30.
Okay.
So it's 3:30. So you've done the obs that we're doing right now. Terrific.
Okay, so yeah, systolic, diastolic, and then the heart rate should always be marked in black, and it should always be a black dot.
Okie dokie. So we'd look at the monitor, and the heart rate is 114. So 3:30, 114 go here. Okay, great. Becky, can you just run me through how to go through this fluid chart, which has always been a bit crazy to me?
Okay, fluid balance is generally done hourly, but it can be done 2 hourly if there's lots of other things going on. So on the intake side, there's everything going in, including the infusions are normally listed across the top.
Okay, so here we've got noradrenaline, rocuronium, fentanyl, propofol, and actrapid. Terrific.
That's right. There's also often a feed running, and the feed type can also be written at the top.
Yep.
And there's an area for the stat drugs that might be given, as well as any fluid flushes that might be given via the NG.
Okay.
So in regards to the infusions, on the infusion pumps themselves, if you press the menu button, it would tell you how much of the volume has been infused. So what most of the nurses here tend to do is to write the volume that's been infused. For example here, the fentanyl here is 27.
Yep.
So in order to work out what's been infused since the last recording, they will deduct the previous recording.
And you just do the math. You just do the math in there.
Yeah,
right.
calculators are available.
Yeah. Okay, so 18 minus 27, I mean that 9. And the next hour would be 34 minus 27. which is 7. Great, okay.
So, and then obviously that's vertically, and then horizontally, obviously you'll make a total for everything for the hour.
So we're doing all the hourly totals in red and all the cumulative totals in black, and so add up all the reds to give us an hourly total.
Yeah.
Yeah.
Yeah, and the colour doesn't matter, just follow whatever
Whoever I see.
Whatever people have been doing previously.
Okay, so basically you just stick to what other people are doing.
Okay, so the main 2 outputs are urine. Nearly all patients are catheterised, and also the NG aspirate
Okay.
that would be done by the nurses, as well as anything from the renal replacement therapy. So again, it's the same thing.
And if in doubt, we just ask one of the ITU nurses, right?
Yeah. Yeah, they're the experts
Okay.
on the RRT machine.
Terrific. So doing the fluid balance is pretty straightforward. Of course, on your first shift here, the ITU nurse will show you exactly what to do. So thanks very much indeed, Becky, and let's go and do a blood gas. Okay, this is what we'll need. Thanks, Becky. 10ml syringe and our blood gas syringe and a cleaning swab. Okay, the next thing is with your 10ml syringe, you need to get rid of all the dead space, all the fluid that's sitting there. So just open to the patient and suck back. It should just come back very smoothly. And you need to take just 3 or 4 mils back into the chamber. And then the self-closing tap just prevents any blood spill there. All right, then with the blood gas syringe, just open, and you probably need to pull it up about halfway. That'll be plenty. So now it's really important to flush the whole thing through, and the various orders you can do this in. I tend to use the same syringe I've done first time, and put that syringe in there. Then can I just reach through and pull the blood gas nozzle, so now I can pull some, actually let's just go like that. Pull some pressure, and the pressure will just flush out our little lock there. Give it a little wipe. Now open again to the patient. Then the final thing, just to flush that through for the patient. Give it a nice long flush to clear away, really clear pretty much all the blood. So now the patient's good. We can see again they've got their blood pressure on their monitor. And we can go and run our blood gas. All right, 2 other things you'll need is one of the patient's temperature and the other is the FiO2. So with the blood gas machine, they've got these, the pass is just here. So, and we're using a syringe. And pass that into this pretty neat system and just follow the instructions on the screen. Top tip, don't throw this away till you've got the result. Guess who threw it away before they had the result and had to do another one. The job's not done yet. We have to fill these in on the chart. Yeah, once you put it on the chart, you don't want to get people confused. So it's quite good just to sign it or put a line through it, and so then people know that's been transferred onto the chart. That's how to do a blood gas. The shifts here are 12 hours long, and you'll have two probably full-hour breaks during that time. So you usually get plenty of rest. The first break will be after 3 or 4 or 5 hours, depending on the nurse you're working with. And during that time, you get to doff all your kit and go and have a nice break back in the staff rest area. Let's go right now. So just to say thanks very much for volunteering to come and work with us here on the ITU. It's great work. You'll be super helpful for the nurses. And we look forward to seeing you here in a shift very shortly.